Hi, I am Dr. Kim Sage. I'm a licensed clinical psychologist. Welcome to my YouTube channel. I am so glad you're here. I am finishing up a series related to trauma and childhood, and we're going to go in next week into a new series on relationships as they are impacted by our childhoods and attachment patterns and things of that nature. So please join me for that. If you're a new subscriber also, please consider joining me, like I said, next week. And if you'd like to be a subscriber, is what I kind of meant to say, is please consider, again, clicking that little bell box, and that way you'll get notified when I post new videos. So this week's videos have been a little drier, I think, than my usual content, but I just wanted to really highlight how these experiences that happen to us in childhood do have significant impacts for our lives, not just when we're in childhood, which I think we don't talk about enough. We're often adults trying to deal and heal with what happened to us in those times or those periods of our lives, and trying to make sense of that little child's brain alongside, the symptoms we have or the repeated patterns we keep getting stuck in, like choosing unhealthy partners and things like that. So I just want to wrap up. There are so many ways to go in terms of the DSM, but as I talked this earlier part of this week around these disorders of attachment, and then yesterday about PTSD, really wanting to highlight how not just discarding that, I had that one thing in childhood, how that might connect and collect with other parts of your story can be impactful and things you want to work on and discuss potentially in therapy or like read about or listen to podcasts about. Trauma has this weird way of sort of weaving its wounds into our life, and we don't always know when and how those are going to show up. And in fact, what happens to me might be the same thing that happens to you, but it might play out very differently in our stories based on a number of factors, from the kind of social supports I had at the time, to my genetics, to additional traumas, to things like financial difficulties, or sort of, from a socioeconomic perspective, what life I was born into, or from from all of the factors that really affect our lives. But to just wrap up and talk about the last few disorders, just want to kind of just go over those kind of quickly. The next disorder that is a trauma and stressor related disorder is acute stress disorder, which is pretty similar to PTSD. The big qualifier here is that it occurs within 3 days to a month, and so it is a shorter duration. The truth is that most people I've ever worked with are often still struggling with a traumatic event much longer after 30 days, and it often becomes then changed into a PTSD diagnosis. That's not true for everyone, of course, but I think that even if the symptoms have gone like way down on the dial, there's often a residual impact, and so that's the stuff I want you to be aware of. So, and then we move into adjustment disorder. This is a very popular one for us when someone comes into therapy. There's an identifiable stressor like a divorce or a job change or something of that nature. It could be lots of things, but it hasn't necessarily been a major trauma. And in fact, it doesn't meet the criteria for trauma. It may have traumatic elements to it though, and those are all individual and personalized. And so that really is just about understanding how something in life can come along and create stress for us and how we might respond. And there are qualifiers like with depressed mood or with anxiety or both or unspecified. Many of you who go into therapy might initially receive a diagnosis like that. The point is we are identifying though that something happened and it has impacted you and caused distress in some fashion, and it is what we call clinically significant, meaning that it is significant enough to impair or inhibit or affect more than just one little part of your life. Usually there are multiple impacts, and so that's important. And then right next to this chapter in the DSM-5 is what we call dissociative disorders. And those really include things that are often found in the aftermath of trauma or traumatic exposure. So things like dissociative identity disorder, which is very correlated to childhood trauma and wounds, dissociative amnesia, depersonalization, and derealization disorders. And those are really about a deeper level of not feeling connected to reality and or to your body. And so that kind of brings up this next part of this video, which I want to just kind of get into for tomorrow's video, which will be really talking about the differences between CPTSD, complex PTSD, and PTSD. And yes, you can actually be diagnosed with both, but I really want to kind of set the stage for how that affects our lives and how they can kind of both be happening and or what the differences are. And really follow up by saying this, that what I want you to understand, as I keep saying, is how impactful trauma is and why we talk about it so much. And that there are certain things that we can struggle with. Now I'm going to go in tomorrow into greater detail about what those things are. But just to kind of give you a reminder, please check out this video on the ACEs study, how adverse childhood events or experiences truly do set us up for a lifetime often of all kinds of issues, from being at higher risk for brain injury to accidents, to risks of pregnancy, unplanned pregnancies, to certainly chronic illnesses and illnesses like cancer and diabetes and heart disease, and it's just autoimmune disorders. It goes on and on and on, to risky behaviors with partners. It's just profound, to maternal, mental, and physical health issues in terms of pregnancy and all of these issues. And so I really think it's important, because many of us, people will come into therapy and say, this happened, that happened, and I don't really want to discuss my childhood stuff. But the truth is that we don't want to stay in that part of your story. But I believe, in the way I work, that it has a profound impact. Who your parents were, how they struggled or not, what you received in terms of caregiving. That's the root of attachment theory. It's not perfect either. But the idea is that I do believe that however you're parented, regardless of culture and experience, which does matter, but like the texture, the nature of those experiences, I see as the heart. Whether it was your financial difficulties, to maybe in your culture you had all the family living together, but maybe your grandmother had significantly untreated narcissism or borderline, for example, and or a lot of power. And so everyone kind of rotated around that person, but that person was very abusive, right? Or your grandfather. So it does impact you, and your parents couldn't protect you, or one of your parents had a disorder and the other parent was such a good parent in comparison. But basically, and people will say, yeah, they were a victim to that abusive parent, but they were still adults and they still did not protect you from what happened to you. And that's impactful and hard to deal with, because that parent seems like the good parent. And in many regards they were, but they also, like I said, allowed and enabled the wounding to continue. So that gets really tricky in therapy. So certainly trauma can affect our lifetime physical and mental health, 100%. Trauma can also impact our sexuality and identity. It can affect how we see ourselves in terms of, like I'm saying, our value, right, in terms of identity. It can affect how we see ourselves as worthy or not. It certainly could show up in relationships. If you've had traumatic events or you've lost a lot of people, right, you might walk around in fear, always thinking that at any moment something bad will happen. And so that consumes you. Certainly we see a very strong relationship between trauma of both complex and PTSD in terms of hypervigilance, that nervous system being highly activated. And so that affects everything you do in your life, right? You're always scanning for danger in every relationship, in your own body, outside the world. That's that neuroception concept. Things around memory and memory loss, concentration issues, learning abilities and language, how you might focus or not, how much or not you might isolate or avoid people, situations, relationships. Going back to sort of, PTSD, for example, you might avoid situations that remind you of the trauma, but that has a profound impact on how you live your life now, that you have a job where you're not supposed to avoid those things, or you have a fear of flying because you lost someone that way, but your job requires that you fly, or the job that you want, right? It can have profound impacts. Certainly issues around worthiness and guilt and shame, definitely on your ability to be a stable human being. For many of us with trauma, we kind of go into over hyperdrive of adult behaviors, and so we're always going to land on our feet, but we struggle other places. So we will always find stability because we have to find it. But for other people, they need that same stability, but their type of difficulties and struggles make creating and maintaining stability really hard. And in fact, what can also happen is, even though we're always in that kind of survival mode of stability, because of our traumas, our childhoods, this combination of things, we keep choosing partners or situations that we think are going to make our lives stable, and we end up actually in very unstable situations as a result. So we're not trying to do that, we're doing our best, but we're unconsciously choosing partners who will eventually, though they might appear very stable financially or otherwise, end up leading us down very different paths. And certainly on our sense of safety in the world and trusting people, and really at the heart how our own nervous systems manage daily life and relationships, and how that attachment pattern, as I talk about so much, how those meet together. And so all of that can be deeply ingrained, especially when it's a relational trauma, like a complex trauma, like difficult parents, or finding yourself in a very difficult situation in terms of your bodily safety. I'm not going to mention that here, but there's all kinds of reasons why we can be in these relationships that should have been safe that we weren't. And also having a traumatic event. Many of us will have at least one traumatic event. And so also, depending upon your life and the kind of parents you have and the risks they take or not, or the level of financial stability you're born into, like that can increase just traumas like being kicked out of your home, or having a parent who struggles. Now we see substance abuse, for example, at every level. It doesn't matter what kind of income you have, but all these things create destabilization, right? And they also increase your chance if a parent is mentally ill or has a substance abuse problem. All of that impacts you. And so that is why I wanted to share just a little bit more about how these clinical presentations, kind of what they look like and how they can affect our lives. And so if any of the things I talked about might apply to you, and you're not in therapy or you can't find support, please do whatever you can. There are low-cost resources you can Google in your area online today. There are different ways and more access now than ever before. I know so many of us, in terms of finding therapists, it has been just difficult. So many of us have been full. Our practices were full before the pandemic and became incredibly full. Many clients are staying in therapy longer now for different things because different things are happening. And so it can be difficult to find support. I know also from certainly a cost perspective. So please know though that if these things have happened to you, that there's a very good chance that it will be beneficial for you in some way to find support in whatever way you can. So as I've mentioned, I do have, which in comparison to therapy are not the same, but can provide actually a lot of supplemental support. I have a course on being raised by borderline and or narcissistic parents who were untreated, a course on healing your childhood, your inner childhood wounds, and also learning to reparent yourself, and a free course on identifying childhood wounds. So the truth is, in many of these courses, for example, that are filled with workbooks and videos and meditations, I actually share a lot more resources than I can ever get to, at least over the course of even a year with a lot of clients. I'm always recommending books and things of that nature, but a lot of patients, myself included, I don't necessarily do homework, but I do think that, outside resources can help heal, like reading a book while you're in therapy. But sometimes your life is it's just not possible at that point. And so my courses or other people's courses who are licensed mental health providers, I believe, are the ones to go for, can be very helpful to supplement your work. Or if that's all you can do right now. So whatever it takes, please, there are so many resources now, please find them for yourself and know that you are worthy of it. And I thank you for being here. We will talk tomorrow about the difference between CPTSD and PTSD, and then we're going to head into all that stuff on relationships. And so I look forward to seeing you then. Please also follow me on TikTok. I have a very not so great way I post on Instagram, though I'm trying to work on it, but I do post on all of these topics literally every day on TikTok for the most part, and sometimes multiple times a day. So it's another great place to find resources and support in terms of like a community. So thanks for watching. Please stay safe and well, and I will see you tomorrow. Take care.